Carpal tunnel syndrome refers to compression of the median nerve at the front of the wrist. The carpal tunnel is formed by the small bones of the wrist as the floor and a strong ligament as the roof. There are 9 tendons and the median nerve inside the carpal tunnel. If the tendons become inflamed, it can cause compression on the median nerve. As it is a confined space, there is nowhere for the median nerve to move if the adjacent tendons become bigger from inflammation. Carpal tunnel syndrome is when the median nerve is compressed within this tunnel, which affects the ability of the nerve to send nerve messages effectively. Patients will usually report classic symptoms of painful pins and needles down the thumb and index middle fingers. It often occurs at night, and relief is sometimes brought about by shaking the hand to try and get the pins and needles to stop. When it is long-standing, it causes weakness to the small muscles that move the thumb and will eventually cause wasting of these muscles. Surgery is performed to release the ligament that forms the roof of the tunnel. This MRI image shows the group of 9 tendons and the median nerve within the carpal tunnel. Here is a post-surgery image with the ligament released. You can see how much more room the median nerve has to avoid being compressed. This ligament can be released through a small 2 to 3 centimetre open incision over the front of the wrist or by keyhole surgery. Both treatments are very successful with a high satisfaction from patients. The surgery addresses the compression of the nerve, and as such, the burning type pain is typically relieved straight away. The pins and needles, however, can still take 2 to 3 months to fully resolve. There will be a dressing and bandage over the wrist, which needs to be kept clean for 2 weeks. There is no requirement for splints or casts, and early range of movement is encouraged. In most cases, patients get immediate relief of the pain with gradual relief of the pins and needles after a few months.